Imagine a time when a single cough could terrify the world. That was the reality during the Spanish flu of 1918, the SARS outbreak of 2003, and even today with viruses like the human metapneumovirus, HMPV. These outbreaks remind us of one important truth. Viruses don't just attack our bodies. They test our resilience, our systems, and our ability to protect each other. Today, we'll uncover what these outbreaks teach us about fighting back. Welcome to Med Origins, where history meets health. Over a century ago, the Spanish flu infected a third of the world's population. It started quietly, spreading among soldiers during World War I, then exploded into one of the deadliest pandemics in history. Back then, people didn't know what caused the illness. There were no vaccines, no antiviral drugs, and no modern ventilators to save the severely ill. But what helped? Simple things. Wearing masks, avoiding crowds, and closing public spaces. These measures saved lives. They weren't perfect, but they showed the power of collective action. Fast forward to 2003, the world faced SARS, a respiratory illness caused by a coronavirus. It spread quickly, causing severe pneumonia in many of its victims. But this time, science had advanced. We identified the virus quickly and traced its origins to civet cats in wet markets. Public health teams jumped into action. Isolation, quarantine, and strict infection control stopped SARS in its tracks within a few months. Unlike the Spanish flu, SARS taught us the value of rapid response and global cooperation. Now, let's talk about HMPV. As of now, China is experiencing a surge in cases of human metapneumovirus, HMPV, particularly in northern regions. This virus is known to cause respiratory infections, similar to the common cold, and can lead to more severe symptoms in vulnerable populations, such as the elderly and young children. Reports indicate that hospitals are becoming overwhelmed due to the increase in HMPV cases, with many patients, especially children, requiring intravenous treatment. While health officials are monitoring the situation, they have not yet declared a state of emergency, although there are concerns about the capacity of healthcare facilities to manage the rising number of infections. The outbreak has sparked discussions and concerns among the public and health experts, drawing parallels to the early days of the COVID-19 pandemic. However, officials emphasize that HMPV is a common respiratory virus and not as severe as COVID-19. The situation is being closely watched, and health authorities are urging the public to remain informed but not alarmed. People should be aware of the following symptoms associated with HMPV, which is currently causing a surge in cases in China. A persistent cough is common and can vary in severity. Many individuals may experience a fever as part of their illness. Nasal congestion or discharge is typical. Some may also report a sore throat. General tiredness and malaise can accompany these symptoms. These symptoms are similar to those of other respiratory infections, such as the common cold or flu, and can affect individuals of all ages, particularly young children and the elderly. If someone experiences these symptoms, especially if they worsen or lead to difficulty breathing, it is advisable to seek medical attention. If you or someone you know is experiencing symptoms of HMPV, it's important to know when to seek medical attention. Here are some key indicators that warrant a doctor's visit. If symptoms such as coughing, fever, or fatigue become more severe or do not improve over a few days, it's advisable to consult a healthcare professional. Any signs of shortness of breath or difficulty breathing should prompt immediate medical attention, as these can indicate a more serious respiratory issue. A persistent high fever, especially if it exceeds 101 degrees Fahrenheit 38.3 degrees Celsius and does not respond to over-the-counter medications, is a reason to see a doctor. If there is any chest pain associated with respiratory symptoms, it is crucial to seek medical help. Symptoms of dehydration, such as dry mouth, dizziness, or reduced urination, should also be evaluated by a healthcare provider. Young children, the elderly, or individuals with pre-existing health conditions should be monitored closely. If they exhibit any concerning symptoms, a doctor's visit is recommended. Differentiating between symptoms can be challenging, especially since many respiratory infections share similar signs. Here are some tips to help distinguish between them. 1. Pay attention to to how long symptoms last and their severity. For example, a common cold typically resolves within a week, while symptoms of HMPV may persist longer or worsen. 2. Certain symptoms can help differentiate infections. For instance, HMPV often presents with a cough and fever, while allergies may cause sneezing and itchy eyes without fever. 3. Look for additional symptoms that may indicate a specific illness. For example, if a sore throat is accompanied by a rash, it could suggest strep throat rather than a viral infection. 4. If over-the-counter medications provide relief, it may indicate a less severe viral infection. If symptoms persist despite treatment, further evaluation may be necessary. 5. When in doubt, it's always best to consult a healthcare professional. They can provide a thorough evaluation and help determine the underlying cause of the symptoms. What lessons have been learned from history? In 1918, people didn't know what caused the Spanish flu. Today, we have advanced diagnostics. Labs around the world can identify viruses like HMPV within days. This early detection means we can act faster to prevent widespread outbreaks. Vaccines were a distant dream during the Spanish flu, but today they are our strongest shield. The rapid development of COVID-19 vaccines showed what's possible when the world works together. While we don't yet have a vaccine for HMPV, the lessons from SARS and COVID-19 are paving the way for quicker solutions. Antiviral treatments have also improved. Doctors now have tools to help patients recover faster and reduce the severity of illnesses. This progress gives us hope for managing current and future outbreaks. Even with all our advancements, basic precautions remain powerful. Wearing masks, washing hands, and staying home when sick can significantly reduce the spread of respiratory viruses. These lessons from the past continue to protect us today. The world is more connected than ever. What happens in one country can quickly affect another. Organizations like the World Health Organization (WHO) play a critical role in coordinating responses. During SARS and COVID-19, global sharing of information, resources, and strategies helped save countless lives. The Spanish flu overwhelmed hospitals because intensive care didn't exist. Today, we have advanced ICUs with ventilators and trained staff to manage severe respiratory illnesses. This progress has dramatically improved survival rates. Outbreaks like SARS and COVID-19 have taught us the importance of preparing our healthcare systems. Hospitals now plan for surges in patients, stockpile supplies, and train staff for emergencies. These lessons are helping us face challenges like HMPV more effectively. The fight against viruses isn't just about responding to outbreaks. It's about preventing them. Research into zoonotic diseases, those that jump from animals to humans, is critical. By understanding how viruses emerge, we can stop them before they spread. Public health education also plays a big role. When people understand how viruses spread and how to protect themselves, communities become stronger. This knowledge empowers everyone to play a part in reducing the impact of outbreaks. Outbreaks don't just challenge our physical health. They test our mental resilience. Fear, uncertainty, and isolation can take a toll, but history shows that humanity's greatest strength is our ability to adapt and support each other. During the Spanish flu, communities came together to care for the sick and provide food to those in quarantine. During SARS and COVID-19, we saw acts of kindness and innovation, from healthcare workers on the front lines to neighbors helping each other. HMPV may not be as well known as the flu or COVID-19, but it's a reminder that viruses are always evolving. Each outbreak, from the Spanish flu to SARS to HMPV, teaches us something new. These lessons help us build a safer, healthier world. So, what can you do? Stay informed, follow public health advice, and take personal responsibility for your health and the health of your community. Remember, every small action, washing your hands, wearing a mask when needed, staying home when unwell, adds up to protect lives. Finally, remain hopeful. History shows us that with science, compassion, and cooperation, we can overcome even the most challenging health crises. By learning from the past and acting in the present, we ensure a stronger, healthier future for generations to come. Now it's your turn. What do you think? Are there lessons from history we're still not using effectively in today's health crises? Or is there a medical story you'd like us to explore next? Let us know in the comments below. And if you found this journey through the origins of medicine insightful, make sure to hit the like button, share this video with others, and subscribe to Med Origins for more fascinating stories where history meets health. Don't forget to turn on the notification bell so you never miss an episode. Thanks for watching, and we'll see you in the next one.